compassionate care truly means. That's Tanner Health. That's care redefined. Learn more at tanner.org.
Oak Mountain Academy specializes in a customized designed academic approach tailored to meet the needs of our families. Our lower division prepares students with the necessary foundation to build excellence. Our middle division provides students with over 15 course offerings, providing them with opportunities to explore their talents and gifts. Our upper division provides personalized academic journeys, allowing them to achieve their dreams. I'm Patrick Uran, head of school, inviting you to journey with us. For more information, visit us at oakmountain.us, where every path leads to purpose.
National headlines and the local stories you care about. WLBB, Carrollton, News Talk 1330, FM 106.3.
And good morning. Welcome to Community Voice. I am your host, Josh Engel. Today is Wednesday, October 15th, and we are talking about the Breast Reconstruction Awareness Day, aka BRA Day, which is just the perfect what's that term? Acronym. I almost said anagram. Thank you. Thank you. Little spoiler alert, there's Vince Scoglietti, but I'll introduce them in a second. Today we're going to be talking about Breast Reconstruction Awareness Day. Our guests today, Dr. Vince Scoglietti with Comprehensive Breast Care of Carrollton. Comprehensive Breast Care Carrollton. We also have Mel Stewart, Dr. Mel Stewart with West Georgia Center for Plastic Surgery. Today, again, we're talking about Breast Reconstruction Awareness Day and all the ins and outs of that holiday, the importance of drawing attention to this, as well as many other topics. But I did want to let our listeners know that this morning's program with Dr. Scoglietti and Dr. Stewart will be and is currently being live streamed on WLBB News Talk 1330's Facebook page, as well as Graddick Communications YouTube. So feel free to check out the live streams. If you have any questions or comments for our guests, happy to read those out. Just put those in the chat. Good morning, Dr. Scoglietti and Dr. Stewart.
Good morning. Good morning.
Thank you both for waking up bright and early and joining us. If we could we get a bit about your credentials, a bit about your story, and we'll start with Dr. Vince Scoglietti.
Sure. Good morning. I'm a general surgeon, so I grew up in the Atlanta area and attended medical school locally, Medical College of Georgia, and then did a general surgery residency at Mercer down in Macon, and then a breast cancer fellowship out in Texas, so UT Southwest in Dallas. And I've been in community practice then ever since, past 12 years or so. I had practice down in LaGrange, and I'm a relatively new addition to Tanner within the past year and a half or so.
Excellent. Awesome. Well, welcome. That's great. We're glad to have you on the program. If we could, let's throw it to Dr. Mel Stewart. Mel, if you could, tell us a bit about yourself, your credentials and background.
Sure. I'm from Wedowee, Alabama, a small town just over the border there in Alabama. I went to undergraduate at Auburn University and then medical school at the University of Alabama in Birmingham. I also did my general surgery residency at the University of Alabama in Birmingham. And then after that, I did a plastics and reconstructive fellowship at Tulane University in New Orleans for 2 years after that. So I've been in school for quite a bit of time. I've been in private practice since that time, and I live in LaGrange, Georgia, with my wife.
Excellent. God, LaGrange is a beautiful town. How cool. And not a bad commute either.
Not at all.
So let's, if we could, how are you each connected to Tanner Health? And we'll start with Dr. Scoglietti.
Sure. So I'm an employee. I work for Tanner Comprehensive Breast Care. So we are a office that manages any sort of breast disease, so benign and malignant conditions of the breast. Mostly it winds up focusing on cancer care. So there's the unfortunate fact is that breast cancer is a fairly common disease. And it seems to affect every community. Lifetime risk for a woman to get breast cancer, unfortunately, is too common. It's 12 or 13%. That's 1 out of every 8 people. So, whether you're in a small town or a big town, there unfortunately is a need for a person like me, to find and diagnose and treat breast cancer. So that's what we're focused on there. But we see a variety of conditions there. But that's our focus.
Dr. Stewart, same question. How are you connected through Tanner Health?
Sure. I am the only plastic surgeon in West Georgia Center for Plastic Surgery, which is a part of the greater Tanner whole. And my job entails a lot of cosmetic surgery, but also things people don't kind of understand or realize is that a very, very large percentage of what I do involves breast, and by default, breast reconstruction is part of that. I spent a good bit of my education learning how to do breast reconstruction and performing that. So that's what I bring to the table.
Excellent. Well, before we get into the meaningfulness of Breast Reconstruction Awareness Day, could we take a pit stop and sort of focus a bit more on breast cancer? So breast cancer in and of itself, why do we think it, or what do the studies, the peer-reviewed studies say about why it is as common as it is? Is there some element of the architecture of the breast that leads to more a higher likelihood of cancer, or the fat cells? What leads to that?
Sure, it's hard to say exactly why the incidence of it seems to be increasing. So that's the most common cancers in men and women, aside from skin and lung, are breast and prostate, and these are tissues that are influenced by hormones over a person's lifetime. And so that's in the past 100 years or so, as our life expectancy has increased, the unfortunate fact is that we seem to develop more diseases later on in life, and breast cancer is, one of those. Likely it's, most common in an older age range. Folks above 65, that's one of the risk factors for breast cancer. It's just simple age. But there's a variety of other things that influence breast cancer risk. And we can get into the kind of the nitty-gritty of those, but just on a population level, the unfortunate fact is that breast cancer seems to be increasing in Western societies. We're not exactly certain why that is. They've done studies where they've looked at populations of people to see, is it genetics or is it environment? And people that, for instance, are at a lower risk in Eastern country and they move here, for whatever reason, their risk seems to be the same as everybody else around them. So it does seem
sobering. It's sobering facts.
It seems to be a environmental, contribution to it for sure. So probably some of the things that we're eating, some of the things that we're doing, just as a society on the whole, has increased the rate, a little bit. And some question is, is the rate truly increasing, or are we just getting better at finding it? There's some question about that, but on the whole, the rates do seem to be increasing a little bit.
So what is Breast Reconstruction Awareness Day, Broad Day, and why is it meaningful for our local community?
So, it's part of the greater, Breast Cancer Awareness Month. October's the Pink Ribbon Month, and patient awareness about these things is important. Early detection actually helps us to be able to better treat it. The outcomes are better if we can find it earlier. And so that's why these awareness campaigns are important, is so that people will have an understanding of, what the problem might be, and then if they see some early sign of it, that they are appropriately looked at and treated. October as a whole, we focus on breast cancer awareness and, making sure people are getting their necessary screening tests, mammography and other forms of screening. And then, breast reconstruction as a topic is sort of nested in that. I'll let Dr. Stewart talk about that.
Sure. The Breast Cancer Awareness Month, or the Broad Day, so to speak, is part of a campaign that's put together by American Society of Plastic Surgery. And quite honestly, it's just to raise awareness of the fact that only about 40% or less than half women that have breast cancer are offered breast reconstruction. And we find that that's it's less likely to have an opportunity to have breast reconstruction in more rural or suburban areas like the one we find ourselves in. And so it's just to bring awareness to the community that, this is an option, and you can, for lack of a better word, be made whole again in most cases, and that is available to you should you suffer the diagnosis of breast cancer.
Time is at 8:39. We're going to go ahead and take our first commercial break. But when we come back, we will continue our conversation with Dr. Vince Scoglietti and Dr. Mel Stewart as we discussed breast reconstruction Awareness Day, and so much more. So stay with us. Community Voice brought to you by Tanner Health and Oak Mountain Academy.
Imagine a place where every heartbeat is monitored with the utmost care, where emergencies are met with swift attention, and where cutting-edge technology enables precise and timely treatments. At Tanner Health, every patient's journey is a testament to resilience, a story of strength, healing, and hope. We go beyond treatment to redefine what compassionate care truly means. That's Tanner Health. That's care redefined. Learn more at tanner.org.
Oak Mountain Academy is a vibrant community built on innovation, academic excellence, and a 64-year legacy of shaping community leaders. I'm Patrick Uran, head of school at Oak Mountain Academy, inviting you to visit the mountain and experience firsthand the passion, purpose, and personalized education that defines our school. Come see how our mission and vision come to life each day. For more information, visit us at oakmountain.us so that you can discover your journey on the mountain, where every path leads to purpose.
And we're back to Community Voice, Wednesday, October 15th. A quick reminder, this morning's episode with Dr. Vince Scoglietti and Dr. Mel Stewart, as we discuss Breast Reconstruction Awareness Day, is being live streamed on our WLBB News Talk 1330 Facebook page, as well as our Gradic YouTube. So if you have any questions or comments for our guest, please feel free to hop in the chat. I'd be happy to read those out to him. You can also share the podcast of this episode, which will be uploaded to this station's website, as well as GradicCommunications.com. Spread the good word of Tanner's mission to bring awareness to breast cancer, and of course, remind folks of the options available for breast reconstruction. Hence our talking today about BRA Day, Breast Reconstruction Awareness Day. So, all right, let's get down to the basics. So, what exactly is breast reconstruction, and why might someone consider it after a mastectomy?
Breast reconstruction is an attempt or a mechanism by which we can take what was lost in the breast cancer resection or removal of the breast cancer. Oftentimes, there are varying degrees of necessity in terms of what is involved in treatment of cancer. The sort of simplest is where they just take a portion of the breast, and certainly Dr. Scoglietti can speak more to that. But if just a portion of the breast is removed, then all we need to do is put a portion of the breast back together. But there are women who have to undergo what's called a mastectomy, which is a very significant and oftentimes very disfiguring procedure. And so we give the opportunity to kind of put that back as it once was, not in terms of replacing it with a new breast by no means, but replacing it with either tissue from the patient's own body, or most likely, and the most common type of mechanism is to use a breast implant for that and reconstruct the shape and the size of the breast and try to match it with the other side.
And to having spoke, a dear friend of mine underwent a double mastectomy maybe 5 or 6 years ago, and she had reconstruction surgery, and since she has mentioned that there are, it's incredible the quality and the selection, like the range of options available in terms of implants. Like, I think people, when they think implants, they think of sort of the older versions that are not as realistic or something, or harder to work with. But meanwhile, there are tons of new options, which it's amazing. So if you weren't able to use someone's own tissue, the options available for implants are amazing.
Indeed, it's come a long way since the mid '60s were the first breast implants, and so we've come a tremendous way with what's available. And quite honestly, if you were shown pictures, it would be very difficult in some cases to tell what person had lost their breast versus what person had not in most cases.
So when it comes to timing, what's the difference between immediate or delayed reconstruction, and how do patients decide?
Immediate reconstruction is where Dr. Scoglietti or one of the breast surgeons removes the breast, and that very same day we put everything back together.
Wow.
At the same operative procedure. Now, oftentimes surgeries involve more than one trip to the operating room. It's not uncommon, and in fact, most cases do. But it is a way that we're trying to diminish or decrease the number of times that the patient is actually put under for anesthesia.
Excellent. And before I get through the next question, we do have our first comment from Danielle and Tristan Stone. Tristian Stone. Dr. Stewart is the best. Appreciate that comment, Mr. and Mrs. Stone. Appreciate that. All right. So you mentioned implants, and then there are flap procedures. There are different methods of breast reconstruction. What should patients know about each?
I think that the main thing is that not every patient is the perfect candidate for each procedure. And I think that's where Dr. Scoglietti and I come in, and we try to help the patient decide. Now, if a patient really, really wants something, even if they're not a good candidate, we have to tell them, hey, these are the kind of risks that you're going to incur with that, so that they're may be able to make the most informed decision that they can.
Sure, of course. So as far as awareness, why do so many patients not know about their rights to breast reconstruction, even though it's federally mandated by law, which I wasn't aware of?
Sure. So that's actually part of my job when we're having the talk about the cancer. Where is it? What is it? What do we need to do about it? When like Dr. Stewart said, many cases, probably 60% of cases actually, we're finding the cancer when it's early, when it's small, and it's easy to deal with, and we actually don't need a mastectomy. But there are still situations that present themselves where the mastectomy is necessary to cure the disease. And when that comes up, it's important to talk about the reconstruction. So, we should consider the historical perspective that there was a period of time where insurers were pushing back on this. And so that's kind of a painful time to remember. But, back to the 1990s, there were instances in which insurers would say, well, this is cosmetic or aesthetic. And so actually there was a federal law passed in 1998. So it's the Women's Health Cancer Rights Act. And what they required, it actually was for private or group insurers. Actually, the federal government's under different rules, but mostly the same, where if we are removing a breast, a part of the body, to treat cancer, that the reconstructive care should be included as well. So thankfully, that law was passed, and as a consequence, when we have that discussion, that's part of my job, is to discuss these things. And not every patient chooses for reconstruction, and the unfortunate fact is some people have medical problems where they're not a great candidate to have additional surgery, and that's the real truth of it. That's the real truth of it. But for the appropriate patient, it is an important part of what we do.
Well, thank you for clarifying that. Are there any myths or fears which keep women from exploring reconstruction as an option, perhaps ones that you guys run into?
I would say that breast implants have had a kind of a storied history in terms of we went through an era from about 1992 to 2006 where silicone, which all breast implants are made of silicone, even the ones that are filled with saline are made of silicone, but those were taken off the market, so to speak. But what you might not understand is that those were only taken off the market for patients who were undergoing cosmetic procedures. They've never been taken off the market for breast cancer patients because they perform so well in breast cancer patients specifically. They've always been available to reconstructive surgeons. And so I think that there's maybe a myth out there that the possibility that silicone could be in lots of ways bad for the body. And again, that's not the purpose of this conversation, but suffice it to say that of all the medical devices that are out there, breast implants have been studied more than any other implantable medical device that we have. And the FDA has proven time and time again that they are indeed safe for us to utilize in terms of reconstruction.
Excellent. This we're not dealing with the same plastic, the little beads that were in shampoo and body wash back in the 90s that just contributed to the microplastics, right? That the epidemic of microplastics in our body. This is something a lot more manageable, very well studied, and you find great results with it. So as far as with Tanner's surgical team, including Dr. Stewart and Dr. Scoglietti, how do you collaborate on patient care?
Sure. So every case is, individually unique in many ways. It's our job. I'm usually seeing people on the front end of things. So I'm the go-to person if there's a lump or there's something that's seen on a mammogram. I'm probably the first point of contact in the sense that we find it and diagnose it. And then once we know what it is, then we, launch into what are we going to do about it? How can we fix this? And, we have as most cancer centers do, a multidisciplinary approach, meaning that, I'm one part of this. I'm the cancer surgeon. Dr. Stewart is the reconstructive surgeon, but there are other people involved in the care of the patient, and we collaborate as a team. We actually meet weekly and discuss all the cases. So that's a benefit. The other people involved in cancer care oftentimes involves an oncologist and a radiation oncologist, and they have different perspectives sometimes, and we collaborate to get the best decision as far as what should be offered and what's the best plan forward, and make sure that it's all evidence based and that we have the most current and modern evidence.
Go ahead.
And I was going to say that, the diagnosis can be overwhelming a lot of times for patients. And just the proximity of Dr. Scoglietti's office and the breast center and the plastic surgery center, having it be as convenient as possible for the patient to get in a timely fashion in order to, formulate a great plan. We meet every Wednesday, so we meet every week as a group, but also communicate individually with each other as well, too, so that we want to make sure that everything's done in a timely fashion.
Absolutely, and this is this multidisciplinary approach that we're talking about here, and these weekly meetings. I mean, these are the kind of things that make Tanner stand out, I imagine. Is there anything else that is uniquely Tanner about this procedure, a process that folks may not be aware of?
I would just point out that it's for a town this size, it may be a bit unusual that we have 3 fellowship-trained breast cancer surgeons and a reconstructive surgeon. So that's the thing, is that coming from, I've had experience in other small towns, and we have more resources, truly. So I think that stands out, and that's sort of unique.
Sure.
Very blessed. Very, very blessed. Time is 8:51. We're going to go ahead and knock out our last commercial break. Thank you to Jessica Kay, the morning show host on KISS 102.7, who came through in the chat. Thanks for covering this topic. Heart emoji. Thank you, Jessica. We appreciate you tuning into the show. It is a very important topic, and I'm very glad that that our guests are here today to discuss it. So we're going to go and take our last commercial break. Community Voice brought to you by Tanner Health and Oak Mountain Academy.
Imagine a place where every heartbeat is monitored with the utmost care, where emergencies are met with swift attention, and where cutting-edge technology enables precise and timely treatments. At Tanner Health, every patient's journey is a testament to resilience, a story of strength, healing, and hope. We go beyond treatment to redefine what compassionate care truly means. That's Tanner Health. That's care redefined. Learn more at tanner.org.
Do the math. At Oak Mountain Academy, our average graduating class has just 12 students. We celebrate a 100% graduation rate with more than $10.5 million in college scholarships offered. Plus, 96% of our students are accepted into their top choice college. Do the math. Can you see the value of an OMA education? I'm Patrick Uran, head of school at Oak Mountain Academy, and I'm here to help you do the math. For more information, visit us at oakmountain.us so that you can discover your journey on the mountain, where every path leads to purpose.
And we're back to Community Voice with our guests, Vince Scoglietti and Dr. Mel Stewart. We already got 2 new comments in the live stream on our WLBB Facebook page. Kimberly McClendon, we are so blessed to have Dr. Scoglietti, as well as a comment from Janet Columber Wagner, who says, love Tanner. And we've got another one, Emery Cobb. These doctors are the best. Check that out. Nice. Thank you for your chats, for folks coming in here and hitting us with some questions. We have about 6.5 minutes left. I did want to touch on this if we could. What new resources or access points are coming soon? Apparently, Dr. Nevers, I believe I may be saying his name right, expansion to Villa Rica might play part of
Dr.
that.
Harper Nivers, a new addition. So she's going to be... I think Tanner will have her positioned in Villa Rica, and so we'll be able to kind of provide care. Right at the present moment, all of our imaging and all of our tools are here centrally located in Carrollton. And, we're able to take care of whatever comes in, but I think that they want to expand and, probably serve the folks on the west end of Atlanta in a more convenient way and have those things set up in Villa Rica. So that's an exciting thing. So she's joined us, and, I think that they're going to be expanding into Villa Rica very soon.
It's an exciting update. Awesome. Thank you for that. So as we work towards the end of the show here, where can listeners go to learn more about Reconstruction, both at Tanner and nationally?
I would say that a good resource for nationally would be the ASPS website. It's American Society of Plastic Surgery. They have a whole section there that discusses reconstruction and many links to send you to appropriate websites that you can learn more about the different options that are available. I would hasten to say that all options are not necessarily available in Carrollton because there are some super specialized type things that we just don't have the resources for. But the vast majority of people that undergo breast reconstruction, we handle, I would say 90 to 95% of those cases and can be done here in Carrollton.
Oh, I love knowing that. That's such a peace of mind for listeners, that this is something you don't necessarily have to go elsewhere. We have so many resources. So as we touched on the last segment, so many qualified surgeons and doctors right here that are in close proximity to each other. And in some cases, as we mentioned earlier, you can go from if you were to get a mastectomy, you can turn around and, before you wake up, you have the reconstruction done as well, which is tremendous. So are there any educational resources, any virtual panels or survivorship support that Tanner offers to patients and family?
Sure. I mean, we actually have, very involved navigators that help us, with those things. Every patient that comes through, we formulate what we call a survivorship plan, and we have a host of resources available. So we actually operate. There's a boutique that's present, and it helps folks, with cancer care related things, wigs, prosthesis, those sorts of things, and those are very important. But yeah, every patient that comes through gets a survivorship plan, and we have the resources available.
And it's why is it important for women to ask their providers about reconstruction options early in their cancer journey?
Well, we're always trying to take care of things in the most expeditious fashion that we can. I think there's. If we consider the historical perspective, if this was decades ago, we had a one-size-fits-all approach to everything, and that was actually very simple, and we'd roll into the OR. And nowadays, there's so many things to offer, and we need to make sure that we have all of our pieces in place. And I'm frequently telling patients, we have time to cross our T's and dot our I's. When it comes to making these plans, on average, when we make a diagnosis to the day we set foot in the OR, sometimes is, in America, in national average, 21 to 24 days. So, it's the kind of thing, if I know early that I need to involve Dr. Stewart, we get that appointment right away so he can give them an opinion about, what's the best thing to do.
Final question. How does education about reconstruction impact a woman's quality of life, confidence, and healing journey?
Well, as a reconstruction specialist, I guess my answer to that would be that, it takes a lot away from a woman when she's diagnosed with breast cancer, and then to undergo a surgery that might change her perspective of her identity and how she feels about herself. If we can do anything to make that better, I think that makes her journey that much easier. It's never going to be easy, but for sure, if we can make it better, that's, I think, Dr. Scoglietti and I's goal.
Mm-hmm. Well, thank you both for taking the time to come on the program this morning. It was both your first time on the Community Voice. You were tremendous guests. Thank you so much for the effort and work you put into spreading awareness, not just about Breast Cancer Awareness Month, Breast Reconstruction Awareness Day, but for the kindness and patience and grace that you show patients to empathize with where they're coming from, seeing that scared and lonely place and providing them with a network of support, network of love and assistance. And thank you both for the great work you do.
Thank you.
Thank
you for having us.
Thank you.
Of course, we're so glad to have you. And to everyone who tuned in with us, again, be sure to share the live stream on our WLBB Facebook page of this morning's Community Voice episode. Spread the good word about what Tanner Health has going on, especially in their awareness and education campaigns. Be sure to check out the podcast. If you don't have a Facebook, you can share that. And if we thank everyone for tuning in with us today, we'll see you next time.